All right, so I'm Dr. Allie Igwe, and I've been working with my partner Tená on a mental health app portal. And I would say that this got started once we saw that we were working with the mental health issue here for Science for Social Equity. We started talking about our own personal experiences with mental health concerns and seeking out mental health support, especially in the midst of a really bad episode. And so that got us thinking about digital options for mental health support, especially in the times of COVID. And so we really wanted to think about what is it that we would want to provide for our community. And so we had a need statement that in order to increase mobile application accessibility and facilitate a more personalized, self-guided wellness experience for Black millennials specifically, we wanted to understand how this demographic uses apps and social media to alleviate the impact of their depression and loneliness on their mental health. And so to do that, we had several different surveys that we put out to get information about if and how Black millennials even access mental health services. And in that survey, we had different questions, like asking, how do you receive mental health services? What barriers exist that prevent you from obtaining mental health services? And which apps have you used to obtain mental health services? We also asked about zip code area because we wanted to focus on the Florida and Virginia area because that is Tená's community. Also, my community. I'm in Miami, or I live in Miami currently. And so we put this survey out through social media and got several responses. And some of the main responses that we saw were that, like, many people did receive mental health services paid by insurance through work, and it was unaffordable otherwise. And that there were identity specific barriers preventing some of the people from obtaining mental health services, specifically related to the availability of Black therapists, Black women therapists, or just any therapist or provider that was able to connect with somebody's cultural or ethnic identity. And then also, many have never thought of using an app for mental health care at all. So then we were like, okay, well, that shows a little gap where people might not even be aware of what mental health apps are out there and what services they could provide in the midst of a crisis. And so we wanted to curate a database of mental health apps in order to help, like we said, facilitate that personalized and self-guided mental health support experience. So we looked at a list from self.com. They had like a list of 50 apps, and we just started there. And we tried to look at like their cultural relevance, if it was accessible financially. So if the app was free or if it had in-app purchases, subscriptions. We then curated or created a searchable data. That's going to be a web page that will be coming available soon. And then we did a focus group to provide feedback on the different apps that we had in our list.
So just as Allie was saying, our focus group was really put into place in order for us to have the most relevant experience for people when they do visit our database that we are curating. A lot of feedback that we got from this focus group really helped us in formulating what it is we needed to see and what the community needed to see from us and this webpage that we were developing. So in order to really engage the Black millennial community, who we are trying to center, we are looking at Black millennials who were ages 26 to 40. And those participants were each assigned 3 apps from that list. 2 apps were random from the list, and then 1 was consistently the Liberate app, which is specifically marketed as an app that is culturally relevant to the Black experience. So we took our focus group and we presented them with a virtual roundtable, and we also did an online survey in order to elicit different data and feedback and just really get their opinions and experience of the apps that are out there that are available to be used. Some interesting feedback that we found would be something like this with the CBT Thought Record Diary user. They said that they actually really enjoyed the app, that they got a better understanding of their stress and anxiety. However, they highlighted the financial barrier by saying that they were pretty disappointed that they had to pay to continue to use it. Another example of that is someone who used the MindShift app, and they said that the colorway was corporate and unengaging for neurodivergent people, which really highlighted an ableism and non-inclusive barrier that we honestly hadn't even considered at the time. And now moving forward, we understand that that's a gap that we need to look into. Lastly, there was the Liberate app, which I said everyone did partake in, and they did get to participate. Most people did really enjoy the app and felt centered as a Black millennial. They felt like their needs culturally were met there, and they were looking forward to their own growth and the growth of the app in the future. So here are just some trends that we kind of came up with that we saw that were highlighted from the participants. When it came to the cultural connectivity experience, we found that overall cultural connection for the apps, people said they felt it about 30% of the time, that yes, I feel there's a cultural connection to me in this app, just randomly selected. And 56.6% said they did not feel a cultural connection. Now, this is in contrast to Liberate specifically, where people said 50% of the time they did feel a cultural connection, and only 20% of the time did not feel a connection at all to the app use. Another trend that we did find was the financial accessibility, and were people actually willing to pay for app usage. And which was really interesting was that only 6.7% were willing to pay for the app, while 63.3% said that they were not willing to pay for the app at all, or for any app at all. And that is a trend that we are definitely want to delve more into and understand deeper, just the why behind that, just what is the barrier of financial accessibility or want in those moments. And one of the last trends that we looked at was the ease of navigation. So we found that about 43% of the people spent 5 to 10 minutes completing their app and doing an app activity within the day. We gave them a week time span in order to actually go in, navigate the app, and we found that only 5 to 10 minutes is what it took for them to complete an app activity. And this really helps us in our research of determining how much time participants were spending and would be willing to spend with their designated apps in the future. So we then took all of this information and went to curate our own database. And as you can see, this is a sneak peek here of that database. While there are similar databases that exist with hundreds of apps, we were hyper conscious about ensuring ease of use, navigation, and cultural infusion specifically as it pertains to Black millennials. This is a webpage that we will have integrated into the Science for Social Equity website, as Allie mentioned. And one of the key things about this is that we know that when people are actually looking for apps, they are already overwhelmed. They are already distraught. And so it can be even more of a stressor to actually sift through all of the information of the apps that exist to find the one that fits you. And so something very that we highlight in this database is the search capability. It allows you to search the symptom that you may be experiencing at the time. And then if you are presented with apps that align with your needs. So once you complete the questionnaire, which you see on the left side of the screen, which is in that purple, it's just a 6-question questionnaire. It allows you to receive a condensed list of apps that are specifically catered to your needs. So the list itself, or the questionnaire itself, asks you things about, in the past 2 weeks, have you experienced anxiety, depression, and loneliness? Or are there things that you are looking for that you would like help with, such as meditation and mindfulness and focusing? And also, would you like to talk to a live person, or are you willing to pay for this app, or are you looking for something that's completely free? So with all of this in mind, we are very excited that this portal exists. This is the Mental Health App Portal. And we are excited for the integration that is going to be placed within the Science for Social Equity website. Within that integration, we also wanted to have the option for constant community feedback in order to help us improve the webpage and identify new and relevant apps. It is our intention that this project will lead to greater racial equity by increasing the accessibility to mental health apps through the provision of a centralized and accessible database highlighting cultural and relevant characteristics. Lastly, the database will continue to help us identify gaps that we may have already seen and will see in the digital mental health resources that we continue to address in the future. Thank you.